Thank you. It's an honor to be here. Just to set the record straight, I have 2 daughters now. You feed them and they grow. I have a 4-year-old and a 1-year-old, and it's absolutely fantastic. And because sometimes the world works in mysterious ways, where I got to present this morning to Lutherus is actually my daughter's daycare. So I can drop her off and then walk next door and talk to a bunch of wonderful people. So I'm going to essentially cover the same PowerPoint, but if you have any questions at all, with my presentations, I'm always like, jump in whenever you can, but if you want to wait till the end, whatever feels most appropriate for y'all. But again, at the end of the day, I really want you guys to take away from this the pieces that you really want to take away from it, and hopefully that'll help you understand. Again, my background is that I used to work for CPS here in Williamson County in Central Texas. I was there for a little over 2.5 years. They actually paid for me to get my graduate degree in social work, and then I was an indentured servant to them for a while. And then after that, have been really involved in many ways with early childhood, and then now my work, I cover many issues with social work, but in particularly, work particularly deep into the child welfare area. So just sort of brass tacks for you from a budget perspective. Before this last, so CPS released their budget. They had their base budget, and they have something called their legislative appropriations request with the additional dollars that they feel that they need to grow. Their initial LAR request was for $534 million. No problem. I spend time up north and I talk real fast. $534 million was what they initially said. This is the growth we need. This is to expand caseload sizes, to bring new programs in, to revamp our existing system. We need that. The legislature came back and the Senate said you can have $260 million. The House said you can have $268 million. So roughly about half of what DFDS wanted. The governor has since come out and said, I think it's closer to $500 million. So he's getting a lot closer. We, through the Child Protection Roundtable, an organization that I work with, which is a coalition of many people involved in child welfare, it's all sorts of diverse backgrounds. If any of y'all are interested, I can definitely get information on that. We put the number closer to $850 million about what they'll need. You heard, I think, very eloquently from Sarah about how this is really a challenging budget session. They're cutting across the board. There's a hearing tomorrow that's about Article 9, which is a section of the budget, which is actually going to have a piece in there which says that every single section of the budget, except for education, K through 12, has to cut 1.5% of their dollars, which will equal about $1 billion in simply across the board cuts. So there are major, major cuts. However, child welfare and mental health, to some degree, have sort of been not necessarily immune from that, but have been pretty exempt. And so in some ways, it's very interesting where you see Medicaid looking at maybe being $2.5 billion underfunded from last session, and yet child welfare maybe $500 million additional funding. So there's I think some challenges to be said there, because one of the things we know is that if you have families that have access to health care, have access to preventive care, those are families that stay out of the CPS system. So in some ways, it's really, I look at it from a holistic perspective. It's not just if we put $500 million into child welfare, we'll fix our kids. It's that these are all intertwined and connected. But CPS especially is important. One of the reasons for that is between 2001 and 2015, we had over 3,000 child deaths due to neglect and abuse. That averaged out to about 4 child deaths per week in the state of Texas due to abuse and neglect. And so obviously this is majorly concerning to us. Additionally, if you don't have something as extreme as a death, we know that kids who've been abused and neglected are more likely to face learning disorders requiring special education, become involved with substances and substance abuse, have school-related problems, enter into teen pregnancy, drop out of school, not attend college, juvenile incarceration rates rise, and arrests for violent crimes. So again, you have major, major outcomes that come from kids who are involved with the system, whether or not those kids, depending on the level of support that they need, I should say. So the financial consequences of abuse and neglect, each year Texas spends an average of $14.1 billion on abuse and neglect. The average lifetime cost per survivor of abuse and neglect is about $210,000, and the average lifetime cost per fatal victim is about $1.2 million. Again, it's hard to put numbers on kids, on lives, on what recovery is, but just so you get sort of an idea of just what it costs the state and just why it's so important, I think, that we invest in this area. One of the things that I think, and you heard, I think Sarah said it really, really well, in regards to domestic violence, in regards to healthcare, in regards to anything, prevention and intervention, early intervention. That's how we help our communities. That's how we support our communities. And so just to put some things in the framework for you, it costs $14.1 billion, like I said, in the effects of abuse and neglect. The entire budget of CPS is about $1.4 billion. So that's about 6% of the total. We spend 0.6% of that budget on prevention programs, which is $92.4 million. So basically, it costs Texas about $14.1 billion to deal with abuse and neglect, and we spend 0.6% of that, $92.4 million on prevention. We have to increase our prevention budget. I think we have to bring more dollars to our communities to get them to support prevention. I use this story with the Lutherans, and it's something that I think hopefully we'll put it into context. But there's a famous research study out there called the marshmallow test. And they brought kids into a room and they put a marshmallow in front of them. They said, I'm going to leave. I'll be back in 5 minutes. If the marshmallow's still there in 5 minutes, you can have 2 marshmallows. If it's gone, well, you had your marshmallow. And most kids eat the marshmallow. I would eat the marshmallow. It's very hard when you see a yummy marshmallow right there. Well, one of the things that I found very interesting is that another set of researchers did a test before they did the marshmallow test. And in the test they did before it, they sat down with kids and they said, okay, I'm going to leave, and I know I've got some crayons back there, and I think I have some paints. Would you rather have paints or crayons to play with? And most kids say paints. Paints are a lot more fun than crayons, right? They leave and they come back. And with half the kids, they say, here's the paints. You know, I found them both. Let's get to it. And the other half, they said, I looked. I couldn't find the paints. They weren't anywhere. All we have are the crayons. And then they did the marshmallow test. And the kids who the adults had come in and had actually followed up on what they had said, and it actually produced what they said they were going to produce. And it built that level of trust. And this is someone you knew you could look to and was going to respond to things. Those kids overwhelmingly waited for the 2 marshmallows because they had faith that was coming. With the other kids who did not get it, who were sort of jilted by the test, those kids overwhelmingly ate that marshmallow, even at higher rates than before. And because ultimately there was no trust built there. And I use that to talk about this is what prevention needs to be from the Department of Family and Protective Services. People don't trust CPS. CPS has a very challenging relationship with the communities. People think CPS comes to your door to take your kids. And if we do not show that CPS is there to offer services, that ultimately CPS is there to help families that don't have the tools or the resources or the knowledge or the connections to help with their issues and get better, then they're not going to trust CPS. And so, again, this is what prevention is all about. And I think we really have to fund those programs. The Child Protection Roundtable would love to see more dollars put into our Texas home visiting programs. I used to work for a home visiting program. They're fantastic. They come into homes often before abuse and neglect is there. They provide the families with resources on how to get medical screenings, on school readiness, on abuse and neglect prevention, on many, many issues. The program I work for, Parents as Teachers, our core message was that child development happens within the context of parenting behaviors. So you as a parent can stimulate and can grow your children in the ways that you want them to grow. That takes dollars. We'd love to see $34.2 million put into that. And you don't necessarily have to write all these numbers down. I'll be more than happy to get this PowerPoint to you guys afterwards. HOPES is a fantastic program which is run through the Department of Early Intervention. It stands for Healthy Outcomes Through Prevention and Early Supports. HOPES initially started out in about 8 communities over Texas. They built it up to about 16 now. I can get you the complete list if you're interested. I don't have all of them off the top of my head, but I know it's Dallas. It's down in the valley. It's some other areas. I believe El Paso has some. But the idea with HOPES is they came into the community with money and they said, we're not just here to give you dollars. You tell us what you need as a community. You tell us what prevention programs work for you. You tell us how we can help support your local efforts, and we'll fund that. And so again, I think this is what we need to do with many of these programs. We need to give dollars to communities who know best, and the communities want to select which pardon me, which services that they're utilizing. Again, we'd love to see about $10 million to expand to 8 additional counties and to expand the current services another $24 million. Abusive head trauma prevention. This was cut from the most recent budget. So we know that when children 0 to 4 months, you often have known as the period of purple crying, where kids just cry. Sometimes you'll feed them. Sometimes you will change their diapers. Sometimes you'll hold them. You'll do whatever, and kids just cry. And if you're a single parent or if you're a new parent and you don't really understand what's going on, it can be very, very frustrating, especially if it happens late at night. And you see a lot of child deaths happen at this early, and also abuse and neglect cases happen at this very early stage. The 2 biggest times when we have child abuse and neglect cases related to development are 0 to 4 months, where kids don't know, where parents often don't know what's going on, and around the time for potty training. That's when we see the most come in. So again, if you can bring resources to these times, you can help these families. And so at the period of purple crying, you can get, there's a wonderful intervention out there, which is actually called the period of purple crying, which talks about moms and dads just putting their kids down, walking away, taking some real proactive steps. Again, utilizing evidence-based research to help with those other prevention and abuse accountability. We would love to see child abuse prevention programs that receive state funds. 75% should be evidence-based, with 25% prompts and practices. We just want to know what the outcomes are. We just think it's important that our programs are putting dollars into research-based programs. We'd love to see university evaluation. of those programs to the tune of $2 million for that. And again, I've got a whole bunch of numbers for you. So the CPS Workforce, the second piece I'm going to talk about is workforce. Before the session even started, the department actually gave about $72.7 million to DFPS to raise salaries for CPS workers. They went from about $37,000 a year up $12,000 to close to $50,000 a year. So our caseworkers are now making close to $50,000 a year, which is a whole lot better than what they were making before. And they gave some dollars to hire new positions, about 850 new positions. I think that there's some idea over at the legislature that the new salaries are going to affect retention. And I would like to say that they're not. They're going to help us with recruitment. If we raise our dollars, we're going to bring better people, hopefully, and by better, I just mean maybe more educated or people who have sort of the degrees and the training that we want to build up into caseworkers. We're going to get more of that population. But if we still have an agency which has really high caseload sizes, not good support for our workers, doesn't really take care of them from secondary trauma, we're just going to lose people at higher salaries. So it's actually going to cost us more money in the long run. I apologize. And so what we really need to do is make sure that we're also supporting our workers once they get to the agency. We can't just give them dollars and think it's going to keep them there. As a matter of fact, if we have really deplorable conditions in the agency, high salaries are just going to keep the workers that we actually don't want to necessarily keep because they're just staying there for the salaries. Again, this is a helping profession. People are often drawn to this area, as many of you know, because of personal beliefs and because of their own values and things that they've seen and have been through, but you still have to support them in that. You still have to make sure that they have dollars so that they can take care of their own families as well. So we would love to see, again, a very targeted rollout by the department of those new caseworker positions. If you just turn around and hire 850 new people tomorrow, you're going to lose half to a quarter to potentially all those people a month from now because it's too much of an overwhelming growth of your workforce. There's a research that I want to study that I want to highlight real briefly because to me this is one of the most powerful things that sort of gives you an idea about what the caseworker can do to a case. But there was a study done up in Minnesota that looked at permanency outcomes on children. So they were able to show that a child who had one caseworker in the system had a 74.5% likelihood of achieving a positive permanency outcome. So almost 75% of our kids who had one caseworker had a positive permanency outcome. You drop that to 2 workers and it goes to 17.5%. It literally plummets. From there it goes down. 3 workers is 5%, 4 workers is 2%. You put a kid at 7 workers and there's almost a 0.1% chance that they're going to have a positive permanency outcome. To me, this is just, it highlights everything about this system, which is important. It's not necessarily what the issues the families are bringing. It's not necessarily the level of abuse and neglect. It's not necessarily these external things. It's what can the department do for families once they get there. And what they can do is keep a consistent worker there who knows the case, who's able to build resources and a unique service plan for the child and the families, who's able to build trust with the kid, who trust with the parents, who's able to serve as that single point of contact and hold all of that institutional knowledge there. That's what's in many ways most valuable. And so we need that person to be the best person that they can be, and we need to keep them there as long as we can. The cost of turnover, about $70 to $80 million annually, it costs us as a state. We lose 46% of our staff within the first year. And again, staff leave because high caseload sizes, because of the stress of the job, all of the things it takes that comes there. We'd love to see the workforce stabilized again. I'll kind of put some numbers out there. There's a whole lot of numbers we have. But I want you to understand at the end of the day, the idea is that the department, it's not just about money. It's not just about handing them a budget. It's also about being smart about how they spend that dollars. So you have to braid policy and budget together. We have to tell people, yes, we need more money in child welfare, but we also need a department that knows how to roll out that dollars in a smart way. One of the main issues that we have is that they've lowered educational requirements for CPS caseworkers. So right now you only need 60 hours of college, as well as 2 years of what they consider to be child welfare experience to serve as a caseworker. And our response is we want to build upon the best. If we're going to be paying close to $50,000, we should have people with social work or human services backgrounds. I'm not saying that someone who has a 4-year degree is smarter than someone who doesn't have a 4-year degree, but if you build your training off of the idea that everyone is coming with a human services degree, you can get them in the field faster because you can already incorporate some of that knowledge into your training. The idea is to get workers out in the field who really look at things not from a criminal justice perspective, who don't show up at the home and say, this is a crime scene, I need to start looking for where the punitive issues can be assigned, but say this is about resources, this is about lack of resources, this is about lack of knowledge. You know, if someone in law enforcement comes up and says, you know, what types of drugs are you using? A social worker may come over and say, what kind of things do you use to handle stress? I've seen this. It looks like it's more challenging. It's just a different approach. And it's not that one is necessarily better than the other, but if we believe in child welfare, this is about helping families get better, then I think we want to bring people who ultimately have that as sort of their part of their values. And then lastly, I want to talk about family preservation and kinship care. One of the areas that the legislature and others have really moved towards the faith-based community on is saying, you got to help us from a kinship care perspective, from a foster care perspective. You have to help us get more capacity. We need more capacity. And I think it's so important that the faith-based community be at the table. As a matter of fact, the faith-based community drew up the table when this first started many, many years ago. I mean, this was where really the implementation of support for child welfare came from. But again, I use sort of, it's not a perfect analogy, but you can't turn water into wine if you have no water. You need resources to work things, and you have to have the tools to make that happen. And so ultimately, we have to give the water to the people out there in our communities, which means we need higher rates for our families. We have to support our kinship placements. So when kids come into care, we always look at kinship placements first. We say, is there a family or a relative who can take care of our kinship families? We know that kids in the foster care system have higher degrees of incarceration, poverty, homelessness, and suicide, higher rates of physical and psychiatric morbidity, double the incidence of depression, higher rates of PTSD than combat veterans. So we know we have a foster care system which has a lot of negative outcomes attached to it. We know that kids in kinship care often have more positive outcomes, and it's not to minimize what can happen in a really good foster placement. It's just most of our kids who come into care are basic kids. 70% of the kids who come into care come in for neglect, and of that, 60% come in because their parent had a substance abuse issue. Texas overwhelmingly brings in more kids into our system because parents have drug issues than many other states. And so these kids actually, in a supportive family environment, are really going to do okay. And so we have to make sure we've got those family environments. The way it works in the state of Texas is if you're a kinship placement, you're going to get $1,000 for the first child, you're going to get $500 for the second child, and then at a year, you're going to get $500 per child. So that's about $2,500 to take care of 2 kids for a year. And if anybody, I became a social worker because I heard there was no math involved, and even I know that it's not going to take care of 2 kids. You get some support for daycare, you get some other supports from the Rainbow Room along the lines of some clothes and whatnot, but it's just not going to cover it. And so most kids who come into a kinship placement, and kinship placement's not all of them, are overwhelmingly grandparents, and they're overwhelmingly grandparents who still work and who have other obligations. Those placements want to support these kids, but then they find the cost is too much. And you also have these kids with behavioral issues, and they'll get kicked out of school, something will happen, they have to take time off from work. So ultimately the costs are what drive those placements, send the kids back into the foster care system. And now we've tried to do it in kinship, move that kid to another placement. We're just setting that kid up for failure and not success. So we want to support our kinships better. There's a great bill out there, which is HB 1549, which is by Representative Burkett. She's really looking into raising these dollars. We'd love to see them raised. So it costs right now, the average cost of a child in foster care is about $11,000. We've got some ideas that maybe looking at $7,000 or so for a kinship placement would be supportive. It's not quite as much as a foster placement. And what I would love to do, and this is what I think is the way to transform the system, since we know most of our kids in kinship care are basic kids, try to use that for as many basic kids as possible. And then when we have our higher needs kids, the kids who have more medical acuity issues, the kids who need some of that more intense therapeutic interventions, have those children in the foster care system. So we really have a foundation of kinship and then build a really strong medical foster care system upon it. Now, it doesn't mean if you're a basic kid, you go into kinship and you go here, but just the idea is we could utilize that for some of our highest needs kids. Again, when it comes to family strengthening and when it comes to really supporting our foster care system, there are wonderful foster providers out there. They really do fantastic jobs. Again, they're called to this. They've put their own dollars and time and resources into this as well. So I think if we can use those for, again, for highest needs kids, we can really help to expand this. Some bills, if you just kind of want to pay attention to, SB 429 is about specifically education requirements for caseworkers. It will require a social worker or human services degree. HB 634 would require any four-year degree. It's once in the House. I mentioned HB 1549. SB 11 is, yes. I know, I apologize, and I'll definitely send them to you. So SB 429 is about 4-year degrees, and it requires a social worker or human services degree. And human services, we've really tried to be as broad as possible, but the idea is it's not quite law enforcement, it's not quite other areas. And HB 634 would require just a 4-year degree. Correct, 634. HB 1549 is sort of, and it's brand new, and I'm still kind of reading through it, but it's kind of an omnibus bill, but it really focuses, it's got a good piece of focuses on kinship and looks at sort of increasing the supports in that area. SB 11 by Senator Schwertner and some others actually just received a hearing last week. And it's a really important bill because it tries to do a whole lot. And one of the interesting pieces is that it actually looks at a community care model for foster care in some regions of Texas. And essentially, this would be taking services traditionally done by the department and moving those into the community. And so it would essentially mean that the department maybe does investigations and all the other care for kids would now be would now be done by a child placing agency. There are issues with that because essentially you are turning over to a private entity, things traditionally done by the state. However, we know that the state has not successful outcomes in many areas. And so there's something to be said for innovation. I think there's still a lot of discussion about whether this is the way to go, but the idea is it would be a gradual rollout and not happen across the state all at once.
And there are particular processes or permits, it's not similar to the caseworkers normally would be. That's one of the ways to be equipped. So that the agencies are preparing for children with certain licensure.
Very much so. There's actually, no, you hit the nail on the head. And there's actually currently in statute more requirements for a child placing agency. They have to have 4-year degrees to place children. The state waived that for their own workers. So the way that they were able to hire the less than 4-year degree was to waive something that is still in place for all of our child placing agencies. So we right now have higher degree requirements outside of CPS than inside CPS. I know that was my face as well. So these is, interestingly enough about SB 11, and again, like I said, there's still, I think, a whole lot of discussion happening around this. The idea is people are trying to think of really ways to improve the system. There's a whole lot of attention. So right now, and that's sometimes a good and a bad thing. Too many cooks, as you know, means a whole lot of people with voices that don't necessarily have the most institutional experience in an issue are now at the table. And yet at the same time, people are trying to bring new innovative ideas. And then real briefly, HB 5 would actually take DFPS and move it outside of the Health and Human Services Agency, have it be its own standalone agency. While on paper that may seem like a good idea, they would have some flexibility on hiring and some other things. We have not been able to keep a commissioner at the Department of Family and Protective Services for longer than 3 years. We're talking 30, 40 years. I mean, the average length of time over there is under 3 years. And so without any consistency at the top, I'm just a little bit concerned about what it would mean to have a standalone agency. I know I went over stuff fast, and I know I talk very fast. No, go ahead.
So this is HB 5 is saying separate.
HB 5, so currently you have Health and Human Services, and you have, right now the whole idea is we're going to push all of the agencies together. Previously you had Department of Aging and Disability Services, you had Department of Assistive and Rehabilitative Services, you had your Department of State Health Services, you had your Department of Family and Protective Services, which is Adult Protective Services and CPS. And then you had Department of State Health Services, which is Mental Health Services. The idea last session was to take all of them and put them all together, have one giant entity. Now the idea is sort of still move everyone together, but take DFPS and have it be alone and completely separate from all the rest. I would be a little bit concerned about access to mental health services, about other access, coordination of services within the state health system. But again, I mention it because it's people's ideas of how do we really bring some radical ideas to the transformation of the system. And just to show you that really many, many things are on the table right now for child welfare. My concern of that is that we would do something without really thinking about the implications, how it can impact kids, and that at the end of the day, we have to be really, really cautious about moving too fast on some of these changes, and that to me seems like a really big, fast change all at once.
Any other questions in the room? Let's take it online. Once, going twice. One more question. We'll make sure we can repeat the question.
Yes, yeah, and I meant to repeat that.
Yes.
I think you mentioned something called the Child Protection Roundtable. Is that correct?
It is.
And can you just tell me a little bit about who they are and
Sure.
how they work organizations?
The Child Protection Roundtable, it's all made up of member organizations. Tex Protects is the founding organization, and they're out of Dallas. They were founded by a woman named, it was founded by a woman named Madeline McClure, who had worked on Wall Street, gone back to become a social worker, and really wanted to get involved. And so she thought, you know, there's a lot of people doing a lot of work. Let's get people together. And so CASA, Court Appointed Special Advocates, is a part of it. Domestic violence. I'll send you the website if you want to see all the people. It's really.
I can go find it. I just wanted to make sure I heard you correctly.
Yeah, and then within the roundtable, we have a couple of committees. There's a CPS Improvements Committee, which I actually chair, and I'm always looking for members. So if it's something you want to be a voice of, go for it. And then there's the Prevention Committee, which focuses a little bit more on prevention in the scheme of things. And then I think they're looking at potentially another committee, which is maybe going to look at kids sort of aging out of care and helping those kids as they transition from the foster care system out into the out into the larger world. But again, the idea is just to bring many, many diverse voices together. There's organizations with faith-based backgrounds there. There's secular organizations. There's organizations who seem like just in child welfare, and there's organizations who sort of tangentially touch it. But the idea is bring everyone together and share information, share resources, and kind of come together with one legislative budget agenda and one policy agenda as well.